Hey YouTube, I am home from visiting with my doctor and I feel positive about my visit with him. And he explained to me that I need to go back in 1 month to make sure once I'm healing more and I continue to do my saline rinses. I have a video from his visit and it does show the inside of my nose and what it looks like. So if you don't want to see that, then don't watch the second part of this video. But basically, I have healing going on and I'm so happy that my husband came with me and the doctor allowed us to video so that I could actually see too. But basically there's big scabs inside that need to fall off. And once he sees behind that, there's bone behind that, and he'll be able to look at that more to see if there is tissue regrowth. And it's possible. He explained to me that it is possible. But if it does grow back, and indeed it might, it may just require a minor surgery or even an in-office procedure where he can go in and remove the tissue. So I'm going back in April, mid-April, and then I will go back in 2 more months and he'll check again. And then I will continue to go every 3 months for 2 years. And then after 2 years, I will go every 6 months. And I'll continue to see him and check and stay on top of this for 5 years. It is an aggressive tissue and they want to continue to monitor it and stay on top of it as it grows, that they get it right away. So I really like this doctor. I'm really happy with him, and I have been looking forward to my follow-up for my surgery because I still am dealing with, I want to use the word excruciating pain because it's been tough. The past couple of days, I haven't really been on camera because I've been hurting so bad. I started a nerve pain medicine. It'll be a week tomorrow. It's called Gabapentin. It's making me dizzy. I feel like I've had a little too much wine, so I have to be very careful when I stand up. My whole world spins when I stand up. And I've been experiencing some other side effects like eye dryness and joint locking. But I've been advised that that's because of my lack of water while I'm taking this. And so I'm really being conscious about how much water I take. And I've had to stay on Advil and Tylenol alternating every 3 hours because I'm hurting. I'm also icing and doing heat pads. And so my pain is coming through here, and the doctor explained this today. My husband videoed some of it, but basically it's nerves. My nerves have to heal. He explained to me that he had to cut a lot of the nerve. And so he used his arm, and he basically explained that, you know, the nerves start at the elbow and they go through to your hand. And if you cut it off and damage it, then it has to grow all the way back. So it's going to take maybe 6 to 18 months for me to get back to normal. I still have no feeling from about here to here, into my front tooth. I have no feeling. So my lip feels really, really big. I've explained this in other vlogs. So those of you who are interested and haven't seen, you can go to my sinus surgery playlist and find out if this is something that you may be going through. It is called an inverted papilloma. So anyway, he also cut all these nerves in here. So I am very, very tender. It's like a migraine here, and it is a constant throb. At times it brings me so much pain that I just have to sit and put pressure on it. And honestly, right now I'm hurting pretty badly, but I just took Tylenol, and in a couple hours I get to take my 800 milligrams of Advil. And I'm taking Gabapentin 3 times a day, but I'm at 300 milligrams 3 times a day. He may bump me up to 600. He may even go up to 900. So he is waiting for me to determine how I'm feeling by next week. And then he will increase my dose if I'm still experiencing this pain. So, okay, for those of you who do not want to watch what happened at my doctor's office, it's like a 3-minute clip. At first he goes in and shows what's going on, and then he stops, comes back and talks to me for a little bit, and then the last minute, at about 1.5 minutes of the video of the piece, he went in and suctioned and tore a piece of the scab off, and he stopped. And I wish he would have kept going, but he didn't. And he explained to me that that's all going to come out as I keep doing my sinus washing. So I have all that to look forward to, and I'll probably update on all of this as I feel things that might be helpful or after my next doctor visit next month. Okay, so here's the part where you're either going to keep watching or you're going to sign off. You ready?
It looks really good. Yeah, and actually there is not that much junk in there. Just a little bit. Let me. Can you hold that for me for just 1 second? No, you've done a great job. Good and clean. So, there's actually not anything blocking that nostril.
That's good.
And one of the things that I think we talked about was sometimes when I open up your nose as widely as I did on yours, paradoxically, you feel like it's blocked. And the reason why is there's not as much resistance in your nose. Because it's so wide open, the air that's blowing through is not pushing on the walls of the nose, and so you don't feel that.
Huh. Chris mentioned something like you said you did the septum. I had one and you tried to correct it?
Yeah, I did, actually. I'm just trying to remember. Yes, I did. And so that's healing too. But some of what you may be feeling where you say it feels obstructed is actually because you're not feeling the air as much anymore. Okay. Okay, that's good. I'm not going to do much more. I just knocked one loose, so you will irrigate that out the next time you irrigate.
Okay.
So really, there's not much stuff.
You want me to hold that for you?
Yeah, that'd be great. We're just, as I said, we just moved into this space, and I haven't. It's not
Got
the same.
reacclimated. Huh?
Yeah, right. I'm trying to work around things, but it looks great.
That's good.
Couldn't be more pleased.
Good to know.
So, this was centered primarily at the very front of that sinus. And so I chose not to go underneath the lip and drill through that and all those things. I felt like I got it all, but not guaranteed, right? And a lot of that is because the attachment was so big that I just saved that. Oh, there we go. So here's the inside of your nose. There's the septum. There's where I straightened it. And then this is within the maxillary sinus. So crust, and then that's bone underneath it, and that's what hurts.
Okay.
And it causing the
Those
numbness.
aren't scabs?
It is. It's scabs, but that's, see that white?
You don't want to pick those, I guess.
No, you wash them out.
Okay.
But so the skin will heal from the sides and push that scab off.
Okay.
Okay?
I'll be so glad when that happens.
And then all of this is healing just like it should. What we'll do is watch over time to see if any of that comes back.
Okay.
And it's possible.
Yeah.
And one of the things I have kind of changed over time how I talk about with my papilloma patients is not to be so flowers and hunky-dory at the beginning. That it's never going to come
But
back.
even if you have to go back in there, it won't be as severe.
It's much easier. And so
the
the connection